Hi everybody, today's my second week since I had surgery. Actually, the surgery was called an anterior cervical discectomy infusion. And basically, I was having a problem with, I couldn't feel my fingers, these three fingers right here. I was having numbness in my arm, I was having pain. Went to the doctor. It turned out that I needed a surgery because my C3, C4, C4, C5, C5, C6 were pretty much compressed, and the one that was causing the most problem was mainly the C5, C6, because apparently the C5, C6 is the one that causes the numbness to this finger. But the main reason I had the surgery was long-term effects. They say that if you don't have the surgery soon, the damage that it causes is permanent. There's no irreversible. It's not reversible. So whatever damage you have when you have this surgery is permanent. So I'm 57 years old, so I figured rather than wait till I'm 67 and have permanent damage, maybe not be able to recover as quick. My dad had this surgery about 10 years ago. I was kind of skeptical of having this surgery, because the doctor that did his in our small town here pretty much did a bad job. He lost his voice, had to eat through a feeding tube, messed up his esophagus. It was just a horrible job, so I was really worried about having this job. So basically what I did, I researched. I'm in Texas, so I just researched the best doctors in Texas, and I found a doctor in Dallas, and he was basically he was voted the best doctor in the country several years running, the best doctor in Texas several years running for this type of surgery. So I went to go see him, and I talked to him. He told me that I needed surgery on those three, the C1, C3, C4, C4, C5, C5, 6. He had to put a plate in there. He was going to put some bone inside there. Rather than grab bone from my hip, he was going to use bone from a cadaver, which he did. And I had some concerns about what had happened to my father. He reassured me that that wasn't going to happen, that he had done thousands and thousands of these surgeries and that it was no problem. And as far as like the nerve damage, he uses a specialty nerve doctor that's in there with him during surgery, monitoring your nerves, and he'll put some pins up here on your forehead, and he's on a computer, he's monitoring your nerves, and also as well as the anesthesiologist is in the surgery room, not the assistant but the anesthesiologist, and he's in there through the whole surgery. As far as my experience with the surgery, they came in, they spoke to me, they wheeled me into the surgery room, they gave me the anesthesia. I was out within a few minutes. Anyway, it seemed the surgery took about 3.5 hours. I was up in the recovery room. I had no pain. The pain in my arm was completely gone. The numbness was gone. I was feeling great through my arm. As far as my neck, I wasn't really in much pain. I was just sort of like sore from my throat. My neck was a little bit sore, but I was in the hospital just one night. The next day they released me. When I got home, I had to drive. Well, I flew home because the doctor was approximately 10 hours from where I live. So I flew home. I stayed in Dallas a few days in the hotel, and then I flew home on a Sunday. So had my surgery on a Wednesday, and Sunday I flew home. 3 days later, 4 days later. But this is my second week. I'm feeling great. I recommend that if you have this surgery that you wear this, not just the foam one, but that you wear this fiberglass thing here on your neck. It keeps your head in place, because what happens is after the surgery, your neck, it feels like when you sleep wrong and you have a stiff neck and you're kind of sore. That's what it feels like. And also when you try and sleep, you're moving around and your head's bobbling around, and you don't want that to happen. And this foam thing isn't supported. But once you put this fiberglass thing on, it supports your neck completely. So when you get in the car, which I haven't been able to drive for 3 weeks, so next week I'll be able to drive. But this thing supports your head completely, you know, and your head's not bobbing around. And I even sleep with it. But anyway, after 2 weeks, I'm feeling great. And as you can see right here, I'll take this off. You see, and I'll take off this cover right here. And as you can see, I don't know if you can see on my neck right here, a little scar. I'll try and zoom in. Right there, a little scar. And that's all. It's pretty much healed. I can move my neck. I'm a little bit sore, you know, like I said, a little bit sore, stiff from the neck, but other than that, I'm fine. No pain in my arm. My neck's fine. I'm probably going to have to wear this for another, you know, couple of weeks. I think by June 17th, today's May 21st, 2015, I had the surgery on May the 6th, 2015. So by June the 16th, I should be cleared by the doctor. Today, I was scheduled for my first post-op, but I couldn't drive up there. So what I did, I took a X-ray locally and sent the X-ray to the doctor. And in the X-ray, you could see the metal plates and the pin, which seemed like he did a great job. But as far as the pain, and if you're worried about this surgery, I wouldn't worry about it. As long as you do your research, go to a good doctor, do your homework, and you should be fine. I know I wanted to do this video to help people who are skeptical and worried about having this type of surgery on their neck, because I know it's near their spine, it's also near the nerves, and they're worried about messing up their voice box or swallowing. But this doctor reassured me everything was going to be fine, and sure enough, I woke up within hours after the surgery. I was pain-free. I was just sore from my throat, but today's 2 weeks. As you can see, it's only been 2 weeks since my surgery, and I'm feeling great. But if you have any questions on this video, you can go ahead and leave them there, and I'll reply and answer them as best I can for you. But I just wanted to like I said, make this video for people who are going to have the surgery, if they can be rest assured that it's not as difficult as they think it is. And as far as I'm concerned, I'm fine 100%, and I'm glad I had it. Better do it now than later, and don't have to mess with it, you know, when you're older. Anyway, I hope you enjoyed the video, and if you have any questions, you can go ahead and put them down, and I'll answer them the best I can. Thank you. Bye.